Hello, I'm Dr. Sajjad. I'm a gastroenterologist. I practice in Coventry and Kettering in Northamptonshire. I'm going to tell you about gastroesophageal reflux disease, which is a very common problem. And a lot of our general population suffers from reflux symptoms and take over-the-counter medications to relieve these symptoms. The reflux disease is caused by excessive acid reflux from the stomach. Our stomach normally produces a lot of strong acid to help digestion of food. But our food pipe, that is esophagus, is not designed to stand acid environment. When the acid from the stomach comes back into the esophagus, then it gives symptoms. And this excess acid reflux can be caused by excessive production of acid in the stomach, or it can be due to opening of the valve that is normally between the esophagus and stomach and prevents the reflux. When this valve gets lax, then there is a high risk of reflux. There are some risk factors in our lifestyle that can produce to excessive acid production by the stomach, like smoking, excessive caffeine intake, alcohol, some foods like fast food, fatty food, spicy food, and big portion meals can also precipitate reflux. And obesity is another risk factor that leads to reflux disease. A sedentary lifestyle is also a risk factor. So, patients can present with different symptoms. The most common symptom is a burning sensation in the middle of the chest. So, patients come through us saying that I get heartburn, burning sensation, which is common symptom, but reflux can also present with dull pain in the chest that can mimic heart pain, and often we recommend that patient needs to rule out heart disease by investigation before coming to us for reflux investigations and management. Also, reflux disease can, if chronic, can lead to swallowing problems, which is what we call is a red flag symptom, and that can, in the long term, also lead to decreased food intake and some weight loss. So, coming to the management of reflux disease, the first advice is to look back at your lifestyle, reflect what you eat, and stop smoking, significantly cut down on caffeine and alcohol intake. If you are carrying extra weight, then do exercise and take low calorie, low portion meals. Try to lose weight and be active. And especially after your evening meals, we recommend that you don't sit down in front of TV and be sedentary, but walk around. Give at least a few hours of gap between your last meal and going to bed. The reflux symptoms are often get worse when patients lie down in the bed, and sometimes we have to advise them to take extra pillows or raise the head end of the bed to improve symptoms. Also, stooping forward can lead to reflux symptoms. So if the lifestyle improvement does not relieve your symptoms, then your doctor will start you on acid suppression treatment. And that often works. There are strong acid suppressant tablets that come in different formulations, and most of them have got minimal side effects. However, if your symptoms are not responding to lifestyle changes and acid suppression treatment, then you need to see a gastroenterologist and need further investigation. The most important investigation we do is endoscopy that allows us to have a look inside your esophagus and stomach, and we can assess you. There is an anatomical condition called hiatus hernia, in which part of the stomach gets herniated into the chest wall, and that leads to opening of the valve and makes you more prone to reflux disease. There are different types, sizes, and types of hiatus hernia, and if not responding to medical management, it needs to be managed by surgery. So endoscopy is an important investigation to assess your reflux disease and helps us to advise on long-term management, whether it's going to be medical or surgical. Another thing I want to tell you about is if the reflux disease is chronic and has not been managed properly, then it can lead to inflammation in the lining of esophagus, what we call esophagitis. So when we do endoscopy, we see that lining of esophagus is inflamed, and sometimes it is so severe that it can lead to ulceration, and when we eat food, it can be painful. If esophagitis becomes chronic, then it leads to changes in the lining of esophagus, and it tries to adapt to acid environment, and the lining becomes histologically similar to the stomach lining. This condition is called Barrett's esophagus, and once Barrett's is diagnosed on endoscopy, then it needs long-term management with acid suppression and follow-up by a gastroenterologist. Because Barrett's esophagus is a precancerous condition, we recommend periodic endoscopy and biopsies to detect any precancerous cells. If at any stage you notice that you are losing weight or having difficulty in swallowing, then you need urgent investigation by a gastroenterologist, and that will involve endoscopy.